Hello and welcome. My name is Chris Rowena, Lead Communications Analyst with the Health Workforce Development Division here at HCAI. We're so glad you could join us today for the Medi-Cal Behavioral Health Community-Based Provider Training Program informational webinar. We're excited to share more about this important opportunity and walk you through the details of the program today. Today we are offering Spanish interpretation for our Spanish speakers. Here are the instructions on how to access that. And we'll give you 1 second to look at these instructions here. Sure that you click down in your title bar on the interpretation icon and select your language there. We'll have English and Spanish available. Please note everyone must select a language, and we do have closed captioning available as well for subtitles. Here's a quick look at today's agenda. We're going to have a housekeeping and introduction, followed by opening remarks and an HCAI overview. We will go to the Medi-Cal Behavioral Health Community-Based Provider Training Program webinar objectives, then the overview of BH Connect and the Workforce Initiative. We will talk about the Medi-Cal Behavioral Health Community-Based Provider Training Program overview, followed by a time for question and answers, and then some closing remarks today. Before we move on, let's talk about housekeeping. A few quick notes to help you get the most out of today's session. Number one, the platform we are on today is hosted in Zoom webinar. Your controls are on the toolbar at the bottom of your screen. Number two, I'd like to point you in particular to the Q&A button. We will be using this Q&A feature for all comments and questions. You can type your questions in at any time. And also, there's a little thumbs up button that you can like people's comments if you also agree with that. And that helps us know what is important to the overall audience today. And then number three, we are recording today's session, and the recording will be available on our website within 7 to 10 business days. And now it is my pleasure to introduce Angela Branch, the Section Chief for Behavioral Health and Policy, to get us started.
Thank you, Chris. Good morning, everyone. Thank you for joining us here today. Again, my name is Angela Brand. I use she, her pronouns, and I'm the section chief here for the Behavioral Health Policy Unit at HCAI. I'm going to go ahead and get us started. I'm going to walk you through how this program fits into California's broader behavioral health or BH Connect initiative. We're going to talk about some of the key program features, and we'll share some of the next steps for those of the eligible applicants that are here on the call today. But before we get started, I wanted to talk a little bit about HCAI and what we do. So let's go ahead and go to the next slide. I'd like to start by grounding us in HCAI's vision and mission. At the highest level, our work is about creating a healthier California where every person, no matter where they live, has access to equitable, affordable, and high-quality care. Our mission is the engine behind that vision. We expand access by strengthening the health workforce, supporting resilient facilities, and providing the data and insight needed to serve communities well. Let's go to the next slide. So you'll see here the HCAI program areas. We work across 5 program areas that you see listed here: facilities, financing, workforce, data, and affordability. The workforce section is what we'll be talking about today, where we invest in programming to expand and diversify California's health workforce for underserved areas and populations. Next slide, please. HCAI is committed to an approach that expands and develops a health workforce that reflects the diversity of California and meets the needs of Medi-Cal members and medically underserved communities. And so how do we do that? We do that by investing in the workforce and administer funding that supports education, training, and placement, especially in underserved areas, while also tackling critical workforce shortages and inequities. Let's go to the next slide. So you'll see here, our work focuses on addressing current and projected workforce gaps to help ensure access to care in communities that need it the most. We do this through data-driven decision-making by publishing comprehensive, actionable data on California's healthcare workforce that informs policy, guides investment, and helps us measure impact. And why does all of this matter? Because a strong representative health workforce improves health outcomes, increases trust in care, and ensures more equitable access across California. Let's go to the next slide. All right. So today we're going to be focusing specifically on the Medi-Cal Behavioral Health Community-Based Provider Training Program, or MBHCB-PTP. This is one piece of a much larger statewide effort to build the behavioral health workforce. Let's go. So the objectives for today are listed here. I'll go through some of the high-level overview elements of BH Connect and how this program fits into the larger workforce initiative. We'll walk through the features of this program, who it's for, eligibility, and what the commitment looks like. And then at the end, we'll close with questions and we'll provide some next steps on how to get started and how you can help spread word to eligible applicants. Let's go to the next slide. So we're going to talk quickly about BH Connect and the Workforce Initiative. BH Connect is California's major behavioral health transformation effort. It's a coordinated strategy to expand access to care, and as part of that, strengthen the behavioral health workforce. The Workforce Initiative is a core component designed to ensure that we have enough trained practitioners to support the entire care continuum. Let's go to the next slide. So I won't read all of this, but in December of 2024, California received federal approval from the Centers for Medicare and Medicaid, or more commonly known as CMS, for the BH Connect 1115 demonstration waiver and related state plan amendments. This approval unlocks the ability to redesign and modernize the behavioral health system, expanding access, improving quality, and supporting the community-based behavioral health services and evidence-based practices needed to serve members living with behavioral health needs. Let's go to the next slide. So this slide and the next slide really dive into the overall goals of BH Connect. This includes a focus on several key goals: expanding community-based and evidence-based services, strengthening family-based supports, improving transitions from facility-based care to community care, and stabilizing individuals during vulnerable periods. Go ahead and go to the next slide, please. So additionally, BH Connect allows California to leverage federal funding to support short-term facility-based care while prioritizing strong community-based services. The initiative focuses on improving stability, recovery, and long-term outcomes for individuals experiencing homelessness or other vulnerable life transitions, including reliance on institutional care and whenever possible. And so a critical part of achieving these goals is ensuring that we have a strong and prepared behavioral health workforce. Slide, please. So the Workforce Initiative will support the training of behavioral health practitioners to provide services across the continuum of care within the Medi-Cal safety net, serving Medi-Cal members and the uninsured. Between 2025 and 2029, HCAI, in partnership with the Department of Healthcare Services, or DHCS, will invest up to $1.9 billion across 5 workforce programs. Through this, recipients will commit to a service commitment of 2 to 4 years in Medi-Cal safety net settings. Also of note is the state has flexibility to carry over unused funding and to redistribute that funding across programs after demonstration year 2. So what that means is after demonstration year 2, we as HCAI can look broadly across the programming. And if we have some that are more dynamic or have higher demand, we can shift up to 30% of that funding to meet that need. Next slide, please. These are the 5 programs that HCAI administers under the BH Connect Workforce Initiative. Together, these create a comprehensive approach to expanding our workforce and providing a more responsive system of accessible care. The community-based provider training program is what we're going to be discussing today. And these key investments will directly support individuals entering or advancing in behavioral health fields. 2 of these programs have already launched. Our student loan repayment and our Medi-Cal residency training programs both launched over the summer of 2025, with the remaining programs, including the one that we're here today to talk about, will launch in early 2026. Let's go to the next slide. All right. So let's jump in and we'll talk specifically about the Medi-Cal Behavioral Health Community-Based Provider Training Program. Next slide. Okay. HCAI launched the Community-Based Provider Training Program to strengthen the pipeline of community-based behavioral health providers. This program will support individuals who are training to become alcohol or other drug counselors, Medi-Cal community health workers, and peer support specialists. The overall goal is to address workforce shortages while building pathways into meaningful community-based careers. Next slide, please. For this grant cycle, up to $21,250,000 is available statewide. Each individual awardee may receive up to $10,000 to cover eligible training and education costs, including tuition, required fees, textbook supplies, and certification or exam costs. Funds will be paid directly to the training or education provider. This policy is outlined in the BH Connect Special Terms and Conditions, also referred to as STCs. The STCs are the agreement that we have with the federal government that provides guidelines for how we can administer this program within California. Let's move to the next slide. So listed here are the eligible professions. So in order to be eligible to apply, applicants must be training for one of the following professions listed here. Alcohol and other drug counselors or AOD counselors, Medi-Cal community health workers, or Medi-Cal peer support specialists. Each profession has specific training and certification requirements that are aligned with Medi-Cal standards. That information is listed here on the slide, but I do want to note that once this program launches, we'll have a grant guide that will be available to folks that are interested that have more detailed information about these programs and the details of the application process and all of the information that we're providing today. So I wanted to note that while there's a lot of stuff listed here, we will also have that information available in the grant guide. Let's move to the next slide. So in exchange for receiving an award, participants will commit to a full-time service obligation in a Medi-Cal safety net setting. This is a 3-year full-time service obligation. We define full-time service as at least 32 hours per week of direct client care or 30 hours per week in a school-based behavioral health setting. Direct care includes behavioral health services such as prevention, early intervention, assessment, treatment, counseling, procedures, patient self-care, patient education, and documentation relating to those patient encounters being treated by or suspected of needing behavioral health services. Direct client care also includes face-to-face care, telehealth-based care, and first-line supervision. In order to fulfill the service agreement, a grantee may work at one setting or multiple organizations as long as they are all within the Medi-Cal safety net settings. Go to the next slide. So again, service obligations must be served in a Medi-Cal safety net setting, which is defined as one of the following entities listed here: a federally qualified health center or FQHC, a community mental health center or CMHC licensed by the California Department of Public Health, rural health clinics or RHCs, and then settings with the following payer mix: hospitals with 40% or higher Medicaid and or uninsured populations, rural hospitals with 30% or higher Medicaid and or uninsured populations, or other behavioral health settings, so certified treatment programs, et cetera, with 40% or higher Medicaid and or uninsured population. Let's go to the next slide. So the other behavioral health settings is a broad category. This includes organizations that are enrolled in Medi-Cal and deliver Medi-Cal covered behavioral health services. There are a lot of different sites listed. I won't read them all, but they will be outlined in the forthcoming grant guide that I just mentioned. I will note that all of these settings must meet the definition of the other behavioral health settings and as outlined on the previous slide, serving 40% or higher Medicaid and or uninsured populations. Go to the next slide. We'll go to the next slide. Okay, so life happens. If things, we have two different service obligation policies that cover waivers of the service obligation are very limited and only granted under extraordinary circumstances such as disability or serious illness. military deployment or activation, or loss of permanent immigration or legal residency status. These determinations are made by a case-by-case basis. And again, more information will be outlined in the grant guide, but we'll move to the next slide, where this outlines the suspensions. There we go. Temporary suspensions may also be granted for events such as natural disasters, institution or site closure, program disruption, temporary disability, or military deployment or activation. Again, the more detailed information about this will be listed in the grant guide. But note the fine print at the bottom that regardless of suspension, all service obligations must be completed by December 31st, 2023. Next slide. All right. So this slide outlines the key dates regarding the launch and awards for this program. The application period will open on March 16th, 2026. This is also when the grant guide will be available for applicants to review. The application for this program will close on April 30th, 2026 at 3 p.m. Award notices are anticipated to be going out in July or August of 2026, with grant agreements proposed start dates of August and September of 2026. The deadline to begin the training or education program is September 2026, and the deadline to complete training is June 30th of 2028. A grantee's full-time service must start before June 30th, 2029, or within 1 year of completing the program, whichever comes first. All applications must be submitted through HCAI's funding portal. And again, once the application process opens, there will be a grant guide available that will provide information about the application and the program, including the information that we shared today, all designed to support you in completing your application for this funding. With that, I'll turn it over to Chris to get us started on questions and answers.
All right, sorry, my video is not working. There we go. Thank you so much, Angela, for all of that. We appreciate that. As you can see, our team has put a lot of thought and effort into this program. We're thrilled to have you here with us to learn more today. As we transition into our question and answer session, please use the Q&A feature located in the Zoom toolbar at the bottom of your screen, just as some of you have already been doing. You can submit your questions at any time, and we're going to go through them live, and we'll do our best to get through as many questions as possible. Although it is possible we may not get to everyone today. We do ask that if you have a question specific to a very personal circumstance, please email us. Instead of have that in this webinar, you can email us at mbhcbp@hci.ca.gov, and we'll make sure that we get that email out a couple more times today throughout this. Right now, I'm going to call our panelists for the Q&A to come on screen and join us. Helping me today with the Q&A will be Lindsay Bradshaw, our program manager, or project manager for this program. And then we do have folks from both HCAI and BHCS with us today to answer questions. So let's jump on in, and we're going to start at the top. Thank you for those that offered some support on helping get people with their audio settings squared away. We appreciate that. First question that I see here is, will we have access to these slides? And the answer is yes. We will be posting these slides on our website along with the recording within 7 to 10 business days. And so you should see that on our webpage in that time frame. Next question, how are you defining community-based provider training programs, since the funding goes through the individual, I believe, through them?
Thanks, Chris. I'll pass this question to Angela.
Actually, I'm going to lean on the team. Can we clarify that question? I'm not sure.
Could we? It was an anonymous question, so I can't call out who asked it, but specifically, if you can make us help us understand a little bit more what you mean by defining community-based provider training program in regards to the funding, so we can understand exactly what you're looking for on that.
Yeah, my only thought, if there isn't clarification, just the program, the training, education, and programs that we listed. I mean, the grant guide will clarify which training entities are eligible, or programs are eligible. But yeah, I'm not entirely sure that that answers their question.
Okay. All right. Next question. Esperanza asks, do employers need to complete any forms to support staff applying for the program? If so, can you provide those details?
Yes, I'm going to pass this question to Nathan, and he'll be able to provide information for the application phase versus the service obligation phase regarding this question.
Yeah, we do request that employers provide information verifying practice site eligibility and work eligibility both on the application and as a monitoring document throughout the service obligation. These are submitted via our portal and request basic information about the site itself, the site's NPI, basic information about the service obligation, about hours worked per week, things like that. Pretty straightforward document.
And maybe to note also, Nathan, that since this is a training based application, that we won't be reaching out to employers during the application period. We will instead be, HCAI will be reaching out to training programs to verify certain information at the application level. And then, as Nathan said, during the service obligation, once the individuals finish their training and moved into their service obligation, we'll reach out to employers.
Fair enough. I got those crossed.
All right. Thank you, Lindsay and Nathan. Next question is, can we please have a copy of the list of what is considered direct client care that you can read but was not written on the slide? Thank you.
Yes, I'll note that this information will be available in the grant guide and grant agreement that's made available on March 16th. And I'm going to kick it to Nathan in case he wants to add anything else to it at this time.
No, the grant guide will be available, and that information should be available in the grant guide. If, however, you have any remaining questions, we do have our inbox. You can always reach out to us via email with any additional questions about, what constitutes the service obligation.
All right. Thank you. Next question, are CHWs, peers, etc. applying through HCAI or their training program?
Angela, would you like to take this question or do you want me to pass it to Nathan?
They'll be applying through HCAI. We'll have a funding portal where they'll be able to submit their application.
Thank you. Simone asks, does the scholarship provide retro payments from the initial registration date?
This may be a question we answer at the launch webinar, but I'll pass it to you, Nathan, in case you're able to answer any part of that now.
I don't know. Let's save it for the launch webinar. I want to double check some stuff about that.
All right.
I think we can say for sure that we're not paying for past academic years of
that is correct.
Training.
Yes.
Yes.
But I'm more looking at, I'd like to wait till the launch webinar to get a bit more information on
absolutely
current training or anything like that.
Yes.
So,
yes.
Yeah. All right. Thank you. Two comments that say 2023. I think we might have had a date confusion on that. But let's just go ahead and pop up the date slide one more time, and we can make sure that we go over the relevant dates. All right. And do we want to speak to any of these dates one more time just to make sure that there's no confusion?
Sure. The application process will begin on March 16th. So the application will open. We'll have the grant guide available. That'll be March 16th of 2026. The deadline to submit applications is April 30th of 2026 at 3 p.m. And we have anticipated award notices listed here in July or August of 2026.
All right. Thank you, Angela. Um, Next question. Can you clarify the role of the training program and the role of the employer in this?
Yes. Nathan, do you want to take this one? Or would you like
Um,
me to pass it to Angela?
no, I think I think I have it.
Okay.
The training program is the program you're literally attending to obtain the training and certification necessary to practice the discipline in question. Um, so the training program itself will provide us some verification regarding the program, your attendance, the costs. The employer comes later in the process during the service or during the active service obligation after you've completed your training. And at that point, we'll work with your employer to ensure you're fulfilling your service obligation. The role is relatively limited. It really is just about confirming that the sites you're working at are eligible and that you're fulfilling the service obligation in terms of hours worked per week, not taking off too much time from the service obligation, things like that.
And just adding, for any of you who have been with us since the very beginning of discussing this program, just clarifying that HCAI is entering into grant agreements with the individuals. HCAI is holding all responsibility for monitoring the individuals through their training and their employment. The training programs and the employers are not in a grant agreement with HCAI, do not have oversight responsibility other than verifying information as HCAI sends it to the employers and training programs.
All right, thank you. Next question from Simone. 3 years of service, are there a total number of hours for service?
Nathan?
No, it's a 3-year service obligation with the expectation of, I want to say off the top of my head, 32 hours per week, I believe. Um, on average, that's an average. We don't necessarily ask you to enter hours worked per day or per week. We ask for average hours each week over the course of 6-month periods for the employment verification reports.
All right, thank you. Bruce asks, will this program be available for non-CMSP counties such as here in San Diego?
Angela, are you able to answer that?
I don't think so.
Okay.
All
I
right,
would
thank
say, Nathan, I mean, it's open to any individual in California that meets the eligibility requirements.
Correct.
We're
The
not,
question was about CMSP counties, correct? This program isn't referencing the list of CMSP counties. We're just looking at eligible practice sites throughout California.
All right, thank you. Next question. At what point in the timeline would the provider be paid?
I believe this is going to be a question that we'll save for our launch webinar. I'm getting a nod. Okay, yes, but we'll
I
definitely
agree.
address that in the launch webinar.
Details to come. William asks, what if you're certified, however, want to further your education?
I do have the answer to this, but Nathan, Angela, I want to give you guys first options.
If you have the answer,
Okay.
feel free.
Yeah. So if you are already certified in the field that you are applying to this application for, so say you're already a certified peer support specialist through Cal Mesa, you're not able to apply to this program to further your training in peer support, for example. So this really is a program that is designed to fund training for individuals who have not yet begun their pathway to certification and would like to do so.
All right, thank you, Lindsay. Let's see. Next question. No funding for administrative staff to return to school or continue education. CalAIM has created a ton of new administrative work for BH entities. Admin staff is harder and harder to find within the BH workforce.
I think we can just acknowledge and understand that comment. Angela, do you want to add anything?
I would, the same, just recognize that that's there. No.
All right. Eric asks, can the funding be used for living essentials if tuition is paid for by the college. This would allow students to focus on school.
The answer is no. Angela, Nathan, anything you want to add?
All right. And I think it's no because of the standard terms and conditions, correct?
Yes, correct.
Okay. All right, thank you. Simone asks, Medi-Cal safety net settings, do you have a list per county or city?
We'll provide additional details in the grant guide, which will be available at launch by March 16th. It does not look like an exhaustive list of names of sites, but during the service obligation portion of the grant, we'll be able to support grantees with understanding this better. Nathan, do you want to add anything?
No, yeah. Like you said, I don't think there is an exhaustive list of sites that qualify as those settings, but HCAI staff, program staff will be able to work with you to determine a site's eligibility, ideally even before you take employment at the site. You can reach out to us, give us information about the site you're considering. We can work to check eligibility of that site and communicate with you to, guide you in that choice.
All right, thank you. Deanna asks, how do we apply for this? Will we get an email notification?
Would you like to reply to this, Nathan?
Yeah, there are email communications going out. Actually, I'm sure Chris could speak to this better than I can about HCAI's mailing lists and informational emails. Otherwise, whether you see an email or not, HCAI's funding portal, I believe there's probably a link to it at the end of this webinar, Chris.
Yeah, so with this, by attending today's webinar, we are capturing your email and you will be added into the email chains going forward for this program specifically. So, for instance, the next webinar that we have, the launch webinar, there will be emails going out for that. And we will have information at the end of the webinar on how to join our mailing list, which we send out monthly and for our newsletter, and that we always list programs that are coming up open in there. You can always check our website, and on that March 16th, when the program opens, you will see for the program website an Apply Now button, which is how you will actually apply. You'll click on that Apply Now, and it will take you to the funding portal to begin your application.
And all the application process is entirely online. I do want to highlight that we don't accept any kind of written or physical applications submitted for this program. So you'll be working through our funding portal to submit your applications and later on any supporting documents for your training program or service obligation.
All right. Thank you, Deanna, for that question. Let's see. Um, Elizabeth asks, could you post the definition of direct client care?
Yeah, Angela, do you want to reread this from, I know you voiced over it in the presentation, or I can read out what we have prepared in the draft grant guide.
I have it here. Direct care includes behavioral health services such as prevention, early intervention, assessment, treatment, counseling, procedures, patient self-care, patient education, and documentation relating to those patient encounters being treated by or suspected of needing behavioral health services. Direct client care also includes face-to-face care, telehealth-based care, and first-line supervision.
All right, thank you, Angela.
And to add to that, all that information is straight from our grant guide, which will be available before the program opens on our website. So you'll be able to review it there as well.
All right, thank you. Next question, does the funding go to the student or to the school for disbursement to the provider?
Angela?
Funding will go to, it does not go to the individual. It will go to the education setting.
Right. Judy asks, it was kicked off several times. Will the webinar be available? Oh, I was kicked off several times. I can answer this one. We are recording this webinar, and the recording will be posted within 7-10 business days on our website for you to be able to rewatch it or send it out to anybody else that you would like to watch it. All right, next question. We're struggling to find an entity that provides training for CHWs. Do local community colleges, other community-based orgs know about this initiative and the process by which they would be paid? Is there any particular agency or CBO that is working with DHCS and HCAI?
Would you like to answer this one, Angela? I know we've done past stakeholder engagement and welcome folks to help us spread the word.
Yeah, we've done some initial community engagement around this. I know that there's also, within the networks of folks in this space, sharing out this information. But I think that, as we think about getting the word out, that's an important question that I think our team will continue to think about as we're wanting to get more information into the hands of the folks who need it for this program.
And I can add that HCAI has a stakeholder list of various CHW training organizations and community colleges that offer as community health worker training. So they will be on the mailing list that get notified about this program launch.
All right. The next two questions I think go along with each other. Applications will be agency or by agency or individually, and then so students, potential individuals can apply for this in their education completion, or orgs can apply for their trainee interns or students currently in programs. I think those two go together.
Yes. So the individuals who are wanting to be trained apply to
Mhm.
this opportunity, and they'll list the training program that they intend to attend. And HCAI will coordinate with that training program to verify that the training program is eligible for that individual to attend. And HCAI will coordinate to provide the funding directly to that training program to allow the individual to attend. Angela, Nathan, anything you guys want to add to that?
No, that covers it. It is an individual application. Orgs are not applying to HCAI for the sake of receiving funding to pay for these programs. This is an individual, sort of a scholarship program.
All right, thank you. Mayala asks, can the funding be used for living expenses? I know we've answered this once before, but I think it's an important point to make sure everybody understands about the program.
Yeah.
Angela?
This cannot be used to cover living expenses.
All right, Lilia asks, if someone has applied and received one of the 5 grant programs, can they apply for this program as well?
I believe this is referring to the 5BH Connect
Mhm.
grant programs, and the answer is no. If they've already been awarded for a BH Connect program, they are not eligible for this one.
I do want to expand on that. If you've been awarded any program outside BH Connect, within HCAI, outside HCAI that comes with any kind of service obligation, you're not eligible to accept this service obligation, and thus you're not eligible to accept this award. We can't allow conflicting service obligations across multiple programs, no matter their source.
All right, thank you. Nisha asks, what role does county behavioral health play in this initiative? Is it only for promotion purposes?
Angela, do you want to address this?
Yeah, can you repeat that question, Chris? I'm sorry.
What role does county behavioral health play in this initiative? Is it only for promotional purposes?
We did do initial stakeholder engagement with the counties, and I know that they've provided feedback as this is going through. In terms of with the application process or verification, I think maybe, I don't know, Lindsay or Nathan, if you have any thoughts on that part.
Yeah, I think the short answer is that there is not a direct role for county behavioral health, but we would love for promotional support we would love to receive promotional support from the county behavioral health departments, and that those departments are a perfect service obligation site for when these individuals do complete their training. So definitely we'll stay in touch with the counties.
All right, thank you. I did see a question that came in a little bit further down, but I think it's an important one for us to speak to before we go on, just so our audience understands the terminology that we're using. The question is, what is the BH Connect funding that you were referring to?
Angela, do you want to take this?
The BH Connect funding overall is so what we're administering, the 5 programs that we talked about, including the community-based provider training program, is part of the workforce initiative of the BH Connect initiative, which is a larger statewide effort to overhaul the behavioral health system. We have a partnership with Department of Healthcare Services to administer the 5 workforce programs, so the 1.9 billion, of which the community-based provider training program is part of. Excuse me, and we do this through an agreement with the federal government to administer these funds.
All right, thank you for that. Let's see, we can click on that one. We've already spoke about the ability to use the funding for personal living expenses. Next question. Hello, so I'm going to continue my education in a 4-year college and taking classes so that I can transfer. My goal is to become an LPHA therapist right after I pass my drug counseling exam and become certified. Not sure exactly what the question is there.
Um, if I can take
Yeah.
a guess, it looks like the this attendee is asking about continuing their education after completing the education that is relevant to this program. Um, so you do have to begin your full-time service obligation before June 30th, 2029, which, does mean that if you pursue any continuing education, that education either has to be complete in time for you to start that service obligation, or be concurrent with your service obligation. You can't put off the service obligation to pursue additional training, certification, licensure, anything like that. You do need to begin that by, June 30th, 2029.
All right, thank you,
Hopefully that
Nate.
answers the question, but let us know if we weren't sure what we were answering there.
If not, it's still very good information for everybody to know. Thank you. Specific schools.
Is that the full question?
That is the full
Um,
question. I
okay,
think they want to know what schools are
sure.
eligible in this.
Yeah. Would you like to take it, Nathan? Or
Um,
I can answer it?
yeah, go ahead and answer it. I don't have that
Yeah.
information in front of me.
Okay. So, for individuals pursuing training in peer support specialist or the AOD space, the application itself will have a drop-down list of all the eligible training programs. Those are going to be based on the information that Angela shared earlier in the deck. Those are the training programs that are approved by Cal Mesa for the peer support side and by the 3 certifying entities in the AOD space. And then for community health workers, that will allow you to provide us the training names since there is not an exhaustive list that DHCS has of approved training programs. And then we will reach out to the community health worker training program to further validate that they meet the criteria in the DHCS state plan amendment, which I know is a very technical answer. So we'll dive deeper into that in the launch webinar. And we, again, will have HCAI staff available to help answer clarifying questions during the application process.
Thank you, Lindsay. I think that probably answered the next question as well.
Yeah.
Has HCAI designated specific training organizations or institutes that people can enroll in?
Yes, it's not based on what HCAI is designating. It's based on what's already uh, approved in those particular spaces per DHCS.
Right. Elizabeth asked, the applicant applies for funding, not the training provider. That is correct. It is the applicant. All right. The website states that the application dates are open as of January 9th, 2026 and closes March 6th, 2026. But she just told us it opens March 6th through April 30th, which is correct.
looks like we need to double check the website, but
Yeah, it looks like yeah, we need to double check what we have on our website. It's also possible on those dates, make sure that we are looking at the community-based provider training program page specifically. We do have other programs that are opening in these time frames as well. So, but we will double check and make sure the dates that have been presented here today are the accurate ones. All right. Elizabeth asks if you're already working at a nonprofit with Medi-Cal and non-insured clients helping with addiction and mental health, does that qualify?
No,
this,
work.
go ahead, Nathan.
Sorry, Lindsay. Work you're doing now will not be counted towards your service obligation. So if you're doing work in this space now, you pursue eligible training or certification through this program. Uh, your service obligation will begin when that training is complete. The work you're doing now, unfortunately, does not count towards your service obligation. We do not count work retroactively towards service obligations.
Camille asks, are we able to get on a list like a training providers directory so people can find us?
Um, so again, we are relying on the lists that already exist for CalMesa. I mean, for the peer support space, it's the CalMesa approved training programs. And for the AOD space, it is the 3 certifying entities. Maybe we could pull that slide up again that shows the professions folks can train for and the training programs that are eligible for these, because I do keep hearing this question come up, Chris.
In the same thing.
Yeah. So if you're on one of those lists already, you're on our application for folks to select in a drop-down menu. And then for the CHW space, there's not an exhaustive list, so we're allowing applicants to type in the training program that they're attending so that HCAI can further verify that it meets the DHCS Medi-Cal requirements.
We're even referring to slide 22 if the eligible professions, is that correct?
Yes.
If you're able to pull up slide 22 briefly for us, thank you.
Um, okay, so these links here, and again, these will be available when the slide deck gets posted on the website. These are where HCAI has pulled the training programs from, or the training program requirements from.
All right, thank you. Salvador asks, does it count to work at 2 different sites, one that serves Medi-Cal and the other that serves clients with no medical insurance?
Nathan?
Yeah, we'll evaluate if you're working at multiple sites. We'll evaluate the 2 sites for eligibility separately. If both sites are eligible, then yes, time spent at both sites will count towards your service obligation. If, however, you're working at multiple sites and one or more of those sites are ineligible, we can only look at the time spent at the eligible sites in fulfilling your service obligation.
Yeah, and I believe what we just spoke to about eligible professions answers this next question for training programs needing state-approved certificates. That that is the list that we're referring to
Yes.
for each of those. So, all right. I am currently in a school for ARC program, addiction and recovery counseling certificate, and work at a sober shelter as a program aide. Do I qualify?
Do you want to take this one, Nathan?
Um, Addiction and recovery counseling certificate, I don't believe that falls under the 3 provider types, but I'm not 100% sure. This might be something we want to follow up on. That said, if you're currently in school, the funds here are paid directly to your institution to cover the cost of your training. So the timing may not line up for you if you're currently in school for that certificate.
All right, thank you. Lilia asks, will the agency receive notification of these grant awardees? Will the agency need to provide employment verification?
Oh, so if by agency you mean your employer, we will work with you to, get a record of who your employers are, confirm their eligibility. You'll actually provide a point of contact at your employer to send the portal form to, the electronic portal form to, for confirming your service obligation. So, short answer, no, we don't necessarily notify um, your employer directly that you've received the grant, but during the course of your grant, your employer will receive notifications about the necessary employment verification forms.
All right. Let's see here. Next question. And we are starting to run out of time, so I am going to try to make sure that we're answering questions that we have not spoken to yet. Let's see. How long does it take to know if we were accepted for the grant?
We will have a stronger timeline to provide you during the launch webinar. Um, Typically, we're looking at about a month and a half, 2 month turnaround after the application closes to make award determinations and notify selected grantees, but that is subject to change. So please do tune into our launch webinar for a more up-to-date estimate on that one.
All right. Will applicants need to submit the name of the community health worker training program in advance of approval? Will the training program selected impact the candidate's chance for award approval?
Do you want to take this, Nathan?
Yeah, you will provide the training program, either selecting from the dropdown or providing that information based on your discipline. The training program selected does not impact your chances for approval. When our grant guide is made available ahead of the program launch, we actually will have a breakdown of specifically what metrics we're looking at for scoring purposes. And this is a scored application. So we are looking at these specific scoring metrics to determine who we award.
All right, thank you. I think we can just make sure that we confirm this. So the fund is for training programs, and when the students meet the requirements and earn the certificate, they're responsible for a 3-year obligation.
Yeah,
Correct.
that's correct.
Yeah.
Nailed it.
Exactly. All right. Let's see. Again, I'm trying to make sure that we answer questions that are not repeats right now. Do you have a description of what would qualify as an AOD counselor? Does that include substance use disorder and recovery services counselor or staff?
Um, Go ahead, Nathan. I was
I
going to maybe see if
apologize.
DHCS wanted to answer this one.
Fair enough. Well,
Jessica or Julie?
Um, right. My
Go ahead,
content
Jessica.
today. Well, as far as what would qualify as an AOD counselor, I'm sorry, I'm rereading the question. We really, I think you said it was slide 22, but when we publish, those live links will be helpful, because we really want to, the purpose is to get folks in Medi-Cal safety net settings and folks who are supporting the Medi-Cal population. And so we'd want you to meet the state plan amendment requirements. And so that specific link will give you a list of what we're looking for as far as this is how you qualify to be an AOD counselor, meaning you can claim billing for Medi-Cal. And so that will be on, as HCAI shared, on the website. So please do look at the training organizations that are approved through those credentialing bodies, because those training programs will lead you to certificates and registration paths to be able to provide those services that we're looking for. I hope that I was able to give the context, but I know that I'm trying to keep an eye on the time here.
Yes, and to reiterate what Jessica was saying, the grant guide will have links to the 3 certifying entities so that you can understand which certifications are eligible in relationship to this opportunity.
All right, thank you. As we are nearly out of time looking through the questions, I did notice several questions regarding what happens if you're not able to fulfill your obligation and you don't meet any of the waiver requirements. I think that's an important one for us to speak to.
Yeah. Nathan, do you want to take this one?
Yeah, there is a breach policy for this program. If ultimately you are unable to fulfill your service obligation, speaking plainly, the breach penalty for this program is fairly severe. And if you have any concern about that, we encourage you to take those considerations in mind before accepting an award offered from this program. If you're unable to fulfill your service obligation, let's see, for this one, you will be required to pay back the award funds, and you will be ineligible for any other programs offered by HCAI in the future. So.
And then I'm going to take this as our last question as we are out of time. Is this program replacing the peer personnel training program?
I don't know, Nathan, if you want to speak to this, I think the answer is it's not um, meant to be the new peer support program. The answer is no. Um, and Nathan, is there anything else you want to
No, that's
add?
fair. None of our programs are necessarily intended to replace other programs. It's just different funding has different terms and conditions for how we can use it. And so oftentimes, it becomes the case that sometimes based on funding, we have to establish different programs that, do similar things. But they're not replacements for each other. As funding is available for various programs, we open up various programs.
All right. Thank you so much, panel, and thank you all of our attendees for your thoughtful questions and active participation in today's Q&A session. Again, if we didn't get to your questions, please don't hesitate to reach out to us at mbhcp@hci.ca.gov. I'm now going to hand it back to Angela for some closing thoughts, and then we will have some resource information at the end for you, and then we'll close today's webinar.
Thanks, Chris. Just wanted to say thank you for everyone that is joining us here today. We recognize that this is time out of your day, but the work that we do, the work that you do is all incredibly important as part of the broader continuum of care in the behavioral health space. So thank you for your interest in this work. Thank you for the work that you're already doing and that you will continue to do. This was just an informational webinar. And so again, we'll have our launch webinar. We'll also have the grant guide that will come out, as well as the supports that HCAI will be providing to help folks through this process. So today is just the first start of that adventure together. So again, thank you for everyone that participated. Thank you to the panelists that joined me today, and Chris for your facilitation. And with that, I'm going to pass it back over to you to close up for today's session.
All right, thank you, Angela. And thank you again to our audience for joining us today to learn more about the Medi-Cal Behavioral Health Community-Based Provider Training Program. We're proud to offer this opportunity as part of our BH Connect Workforce Initiative, as well as our broader efforts to strengthen California's behavioral health workforce. As a reminder, this program opens on March 16th, 2026 at 3 p.m., so stay tuned for more information. But before we wrap up, we invite you to explore the many resources on our website to support your journey in the health workforce. We also invite you to stay connected with us on your favorite social media platform. We are online, have a presence on all of these that you see here. We would love for you to tag us with any work that you're doing in this space as it relates to HCAI and to see the great work that you're doing to help our state be a healthier place. One of the things that we mentioned earlier is that we would love for you to sign up for our monthly Health Workforce Program Update newsletter. You can do so by going to this link right here on the page, hci.ca.gov/mailing list. When you do so, make sure that you click on any one of the options under Health Workforce, and you will be added to our monthly newsletter. And that is your best way of staying up to date on the things that are coming up for HCAI Health Workforce Development programs. You can always contact us at any time. We do have a BH Connect helpline, which is 916-326-3899. You can ask questions of them, and then you can also email us, as we've mentioned, at mbhcbp@hci.ca.gov. mbh.ca.gov. Thank you again for attending. We appreciate your time and interest. Please stay tuned for more information about the MBH Community-Based Provider Training Program. And with that, we do conclude today's webinar. We hope you have a wonderful day.